Question 241. A client is suspected of having hepatitis. Which diagnostic test result will assist in confirming this diagnosis? A. Elevated hemoglobin level. B. Elevated serum bilirubin level. C. Elevated blood urea nitrogen level. D. Decreased erythrocyte sedimentation rate. Question 241. Answer: B. Elevated serum bilirubin level. Question 241. Explanation: laboratory indicators of hepatitis include elevated liver enzyme levels, elevated serum bilirubin levels, elevated erythrocyte sedimentation rates, and leukopenia. An elevated blood urea nitrogen level may indicate renal dysfunction. A hemoglobin level is unrelated to this diagnosis. Question 242. The nurse is reviewing the physician's orders written for a male client admitted to the hospital with acute pancreatitis. Which physician order should the nurse question if noted on the client's chart? A. NPO status. B. Nasogastric tube inserted. C. Morphine sulfate for pain. D. An anticholinergic medication. Question 242. Answer: C. Morphine sulfate for pain. Question 242. Explanation: meperidine, Demerol, rather than morphine sulfate is the medication of choice to treat pain because morphine sulfate can cause spasms in the sphincter of Oddi. Options A, B, and D are appropriate interventions for the client with acute pancreatitis. Question 243. A female client being seen in a physician's office has just been scheduled for a barium swallow the next day. The nurse writes down which instruction for the client to follow before the test. A. Fast for 8 hours before the test. B. Eat a regular supper and breakfast. C. Continue to take all oral medications as scheduled. D. Monitor own bowel movement pattern for constipation. Question 243. Answer: a fast for 8 hours before the test. Question 243. Explanation: a barium swallow is an X-ray study that uses a substance called barium for contrast to highlight abnormalities in the gastrointestinal tract. The client should fast for 8 to 12 hours before the test, depending on physician instructions. Most oral medications also are withheld before the test. After the procedure, the nurse must monitor for constipation, which can occur as a result of the presence of barium in the gastrointestinal tract. Question 244. The nurse is performing an abdominal assessment and inspects the skin of the abdomen. The nurse performs which assessment technique next? A. Palpates the abdomen for size. B. Palpates the liver at the right rib margin. C. Listens to bowel sounds in all 4 quadrants. D. Percusses the right lower abdominal quadrant. Question 244. Answer: C. Listens to bowel sounds in all 4 quadrants. Question 244. Explanation: the appropriate sequence for abdominal examination is inspection, auscultation, percussion, and palpation. Auscultation is performed after inspection to ensure that the motility of the bowel and bowel sounds are not altered by percussion or palpation. Therefore, after inspecting the skin on the abdomen, the nurse should listen for bowel sounds. Question 245. Polyethylene glycol electrolyte solution, Golightly, is prescribed for the female client scheduled for a colonoscopy. The client begins to experience diarrhea following administration of the solution. What action by the nurse is appropriate? A. Start and for infusion. B. Administer an enema. C. Cancel the diagnostic test. D. Explain that diarrhea is expected. Question 245. Answer: D. Explain that diarrhea is expected. Question 245. Explanation: the solution Golightly is a bowel evacuant used to prepare a client for a colonoscopy by cleansing the bowel. The solution is expected to cause a mild diarrhea and will clear the bowel in 4 to 5 hours. Options A, B, and C are inappropriate actions. Question 246. The nurse is caring for a male client with a diagnosis of chronic gastritis. The nurse monitors the client knowing that this client is at risk for which vitamin deficiency? A. Vitamin A. B. Vitamin B12. C. Vitamin C. D. Vitamin E. Question 246 Answer: B. Vitamin B12. Question 246 Explanation: Chronic gastritis causes deterioration and atrophy of the lining of the stomach, leading to the loss of the function of the parietal cells. The source of the intrinsic factor is lost, which results in the inability to absorb vitamin B12. This leads to the development of pernicious anemia. The client is not at risk for vitamin A, C, or E deficiency. Question 247. The nurse is reviewing the medication record of a female client with acute gastritis. Which medication, if noted on the client's record, would the nurse question? A. Digoxin, Lanoxin. B. Furosemide, Lasix. C. Indomethacin, Indocin. D. Propranolol hydrochloride, Indril. Question 247 Answer: C. Indomethacin, Indocin. Question 247 Explanation: Indomethacin, Indocin, is a non-steroidal anti-inflammatory drug and can cause ulceration of the esophagus, stomach, or small intestine. Indomethacin is contraindicated in a client with gastrointestinal disorders. Furosemide, Lasix, is a loop diuretic. Digoxin is a cardiac medication. Propranolol, Indril, is a adrenergic blocker. Furosemide, digoxin, and propranolol are not contraindicated in clients with gastric disorders. Question 248. The nurse is assessing a male client 24 hours following a cholecystectomy. The nurse noted that the T-tube has drained 750 milliliters of green-brown drainage since the surgery. Which nursing intervention is appropriate? A. Clamp the T-tube. B. Irrigate the T-tube. C. Notify the physician. D. Document the findings. Question 248 Answer: D. Document the findings. Question 248 Explanation: Following cholecystectomy, drainage from the T-tube is initially bloody and then turns to a greenish-brown color. The drainage is measured as output. The amount of expected drainage will range from 500 to 1,000 milliliters/day. The nurse would document the output. Question 249. The nurse is monitoring a female client with a diagnosis of peptic ulcer. Which assessment findings would most likely indicate perforation of the ulcer? A. Bradycardia. B. Numbness in the legs. C. Nausea and vomiting. D. A rigid, board-like abdomen. Question 249 Answer: D. Rigid, board-like abdomen. Question 249 Explanation: Perforation of an ulcer is a surgical emergency and is characterized by sudden, sharp, intolerable severe pain beginning in the mid-gastric area and spreading over the abdomen, which becomes rigid and board-like. Nausea and vomiting may occur. Tachycardia may occur as hypovolemic shock develops. Numbness in the legs is not an associated finding. Question 250. A male client with a peptic ulcer is scheduled for a vagotomy and the client asks the nurse about the purpose of this procedure. Which response by the nurse best describes the purpose of a vagotomy? A. Halts stress reactions. B. Heals the gastric mucosa. C. Reduces the stimulus to acid secretions. D. Decreases food absorption in the stomach. Question 250 Answer: C. Reduces the stimulus to acid secretions. Question 250 Explanation: A vagotomy, or cutting of the vagus nerve, is done to eliminate parasympathetic stimulation of gastric secretion. Options A, B, and D are incorrect descriptions of a vagotomy.